Under the theme of development communication, today we are going to discuss about the reporting on epidemics and health crisis, a development communication approach. First of all, we have to understand about the basics of reporting on epidemics and health crisis and the term epidemics and health crisis. In an age where global health emergencies can unfold rapidly and unpredictably, the role of the media becomes more critical than ever. This presentation explores how development communication, a strategic use of communication to promote social development, can shape responsible, accurate, and impactful reporting on epidemics and health crisis. From battling misinformation to fostering public trust and encouraging behavior changes, journalists and communicators are on the front lines not only of information dissemination but of saving lives. This session will highlight key principles, challenges, and strategies for reporting health emergencies with a development lens, ensuring that communication empowers communities and supports effective public health responses. First of all, we have to understand the term epidemic. An epidemic refers to a sudden, often unexpected increase in the number of cases of a disease above what is normally expected in a specific population or geographical area during a particular period. It signifies that a disease is spreading more rapidly and extensively than its baseline or usual occurrence. Localized or regional spread, primarily confined to a specific community, city, region, or even a country. An unexpected increase. The number of cases is significantly higher than the usual predictable level for the disease in that area. Identifiable cause, often linked to an infectious agent, virus, bacteria, maybe parasite, but can also refer to non-infectious conditions. Requires public health response, triggers immediate investigation and control measures to contain the spread. The Ebola outbreak in West Africa, for example, 2014 to 2016 was an epidemic as it was largely confined to specific countries in that region. A sudden spike in cholera cases in a particular village after a food would also be considered an epidemic. Distinction from pandemic. A pandemic is a global epidemic, meaning the disease has spread across the multiple countries or continents, usually affecting a large number of people worldwide. The key difference is the geographical scope. And now we are going to understand about the health crisis, the term health crisis. Health crisis is a broader term that encompasses any emergency or complex situation that significantly impact public health in one or more geographic areas, potentially leading to loss of life, widespread illness, and substantial disruption to society and the economy. It doesn't necessarily have to be an infectious disease outbreak. Broader scope of health crisis can be caused by infectious disease like epidemics or pandemics, but also by a non-communicable disease, environmental hazards, natural disasters, or industrial accidents. Significant impact result in severe consequences for community health, including illness, disability, and mortality. And it requires coordinated response, often necessitates a multi-sectoral approach involving healthcare, government, emergency services, and sometimes international aid. Public perception and communication in terms of health crisis, how a health crisis is communicated to the public can heavily influences its impact potentiality and leading to panic or distrust if mishandled. Examples of health crisis: the COVID-19 pandemic was a global health crisis that began as an epidemic. The major earthquake that destroys hospitals and contaminates water supplies, leading to a surge in injuries and waterborne illnesses, also termed as health crisis. A toxic chemical spill affecting a community's air and water quality, causing widespread respiratory issues, can be the health crisis. A severe famine leading to widespread malnutrition and increased susceptibility to diseases, also termed as health crisis. Now, we are going to understand about the health crisis reporting. Health crisis reporting is a specialized area of journalism that focuses on the swift, accurate and responsible dissemination of information during outbreaks, epidemics, pandemics and other public health disasters. The event can range from infectious disease like the Ebola, COVID-19 and cholera to environmental health hazards or mass casualty incidents. The core media responsibilities during such crisis: inform the public with accurate, clear updates, providing timely and verified information about the nature of the crisis, its spread, symptoms, prevention and available resources, local hospitals, government initiatives, what Nagar Nigam or municipalities are doing. All kind of local need and necessary information for that particular community or particular area must be communicated with media on time without any sensational inputs. Avoid spreading panic or misinformation. Journalists must exercise extreme caution to prevent sensationalism, speculation or the amplification of unverified claims which can lead to unnecessary fear and harmful action. I remember during COVID time, one television reporter or journalist announced that one particular city in Delhi NCR is going to, during the lockdown, some sealing hoga, is tarah ka, there was some breaking news. And after the television announcement, this breaking news that this city will be sealed today, people acted panic and they purchased lot of grocery items, milk, lot of water and everything. But what was the actual news? During lockdown, during COVID, sealing hoga. But after sealing, there was no closure or shutdown of the grocery shops or milk shops or vegetable shops. But what was the result of that? I can say that kind of miscommunication. The panic spreaded and people purchased lot of material, and after a week or 10 days lot of vegetables and lot of other things was turned to garbage. Avoid spreading panic or misinformation. Journalists must exercise extreme caution to prevent this kind of sensation. Hold authorities accountable, scrutinizing the response of government agencies, health organizations and other relevant bodies to ensure transparency, effectiveness and accountability in managing the crisis. Humanize the crisis through stories. Beyond statistics, it's crucial to tell the personal stories of those affected, patients, healthcare workers, families, to foster empathy and provide a relatable human dimension to the crisis. Information overload. In the digital age, a deluge of information from various sources, some credible, many not, can overwhelm journalists. Shifting through this volume to find reliable data is a constant struggle. Lot of information on social media, WhatsApp, Facebook, and other platforms, and you are a media communicator, you are communicating from a credible source. You have to verify that data, that information through a government agency or any other particular responsible website or government official or any other expert of that subject domain. Misinformation and disinformation, yes, you have to be careful while communicating the crisis reporting from the ground zero. The rapid spread of false or misleading information, especially through social media, is a significant threat. Journalists must actively debunk myths and counter harmful narratives. Sensitivity. Reporting on topics involving severe illness, death, and widespread fear requires immense sensitivity and empathy. Journalists must navigate these emotionally charged situations with professionalism and respect. Access restrictions. Outbreak zones, hospitals, and quarantine areas are often off limits to maintain public safety and prevent further spread, making on the ground reporting difficult. So, you have to be careful while accessing these restrictions. You can visualize, you can cover that quarantine area from some distance. No need to visit the hospital during this kind of epidemic or any health crisis situation. Rapid developments, health crises are dynamic. The scientific understanding, public health guidelines, and the actual spread of a disease can change by the hour, requiring journalists to adapt quickly and update their reporting continuously. For example, during COVID time, "दो गज की दूरी and mask है ज़रूरी" was the slogan spreaded by our media, very well communicated throughout the country, and our citizens followed that mandate. But lot of misconception, misinformation, and lot of false messages were aired by lot of channels and lot of media platforms, like you can drink or you can take bath with sanitizer. Absolutely wrong. Sanitizer can kill the virus. No, not at all. Virus cannot be killed by any medicine or any sanitizer, because virus is not a living thing. Virus is a link between the living and non-living. So, virus cannot be killed, but virus can be deactivated with the help of sanitizer or with the help of water and soap. So, this kind of false information, mis or disinformation or manipulated content must be barred or banned in our communication. COVID-19 outbreak, what misinformation has spread in India? Now, we are going to discuss about some of the misinformation from our social media, your social media, and lot of content I have taken from Hindi social media. प्याज खाने से कोरोना वायरस को रोका जा सकता है. This is nothing but misleading. Onion has no property to deactivate the virus or to stop the coronavirus or COVID-19. Aspirin coronavirus संक्रमण को ठीक कर सकता है. This is again factually incorrect. During COVID, if you have some breathing problem, if you have some blood pressure problem or heart disease, so doctor may prescribe aspirin for to cure your other disease or like blood pressure or heart or anything else. But aspirin has no relation with coronavirus. So, you need to talk to your doctor, discuss with scientific experts any biological scientist or expert, and visit the websites like WHO, Ministry of Health and Family Welfare, Indian Council of Medical Research, where you will find lot of awareness material and content to avoid this kind of miscommunication. अब ये नक्शा दिखाता है कि वुहान निवासियों ने बीमारी के प्रकोप के बाद पूरी दुनिया में कैसे यात्रा की, इससे विश्व स्तर पर बीमारी फैली. Anybody can copy the map from internet and can create his or her own story, and this is nothing but miscommunication. This is misrepresentation of a correct map. This map is showing the air traffic, and you are just putting your story on the correct air traffic map that कि वुहान से पूरी दुनिया में लोग भेजे गए और ये बीमारी फैलाई गई. दिस इज मिसरिप्रेजेंटेशन ऑफ ए करेक्ट मैप. नमक के पानी या सिरके से गरारे करने से कोरोना वायरस संक्रमण से बचाव होता है. And the information given in the box, a very small font, and it is difficult to read, but it says that कि वायरस आपके गले में जाने के बाद 4 दिन तक आपके गले में बैठा रहता है और आप गार्गिल करेंगे तो वो वायरस खत्म हो जाएगा या मर जाएगा. दिस इज इनकरेक्ट, कंप्लीटली फॉल्स. गार्गिल करना या स्टीम लेना हैज नथिंग टू डू विद वायरस. वायरस से कोई लेना देना नहीं है. Lot of our media channels spread this information during COVID time कि गार्गिल कितना बार करना है, स्टीम कितना बार लेना है. All has some sense for your to cure your normal sardi khansi zukham, cold and cough, and you can do any time gargling and steam, evergreen, all good. But this is misleading that कि आपका वायरस खत्म हो जाएगा गार्गिल करने से. नो, नॉट एट ऑल. वायरस को खत्म करने के लिए, टू डीएक्टिवेट द वायरस, एनी वायरस, दुनिया का कोई भी वायरस को अगर आपको डीएक्टिवेट करना है, खत्म करना है, तो यू नीड बॉइलिंग वाटर. और क्या आप बॉइलिंग वाटर से गार्गिल कर सकते हैं? नो, नॉट एट ऑल. आपका गला जल जाएगा. ऐसी गलती कभी मत करिएगा. तो ये सारे मैसेजेस यू हैव टू कम्युनिकेट थ्रू मीडिया टू sensitize your audience and citizens. सोना बाथ एंड हेयर ड्रायर का जो गर्म हवा है वो कोविड-19 को रोकेगी या उनका इलाज करेगी. दिस इज अगेन फैक्चुअली इनकरेक्ट. एज आई said that gargles and sauna bath or steam or anything can cure your normal cold and cough. No relation with virus. दिस इज अगेन वन मैप. आपने एक पिक्चर उठाया, उसमें येलो कलर से आग लगा दिया और बोला कि यहाँ पर कोरोना वायरस का सामूहिक दाह संस्कार हुआ और वहाँ सल्फर डाइऑक्साइड बहुत फैल गया. एंड दिस अगेन मैनिपुलेशन, मैनिपुलेटेड कंटेंट. देयर इज नो ट्रुथ इन दिस, इन द फोटो. आप कभी भी कोई भी फोटो में आप कंप्यूटर में बैठ के उसको डिज़ाइन कर सकते हैं और फॉल्स मैसेज फैला सकते हैं. तो इस चीज़ों को हमें रोकना है थ्रू आवर मीडिया चैनल्स, थ्रू आवर सोशल communications, and all our active network on our social media presence. Now, ethical reporting is the bedrock of credible health crisis journalism. Do not harm. This is the paramount principle. Journalists must avoid sensationalism, creating undue panic, or reporting in a way that could inadvertently put people at risk. Balance between the urgency and accuracy. While the public need immediate information, accuracy must never be sacrificed for speed. बहुत तेज चैनल हैं आप, लेकिन आपकी तेजी में कहीं गलत इंफॉर्मेशन ना चली जाए, किसी का नुकसान ना हो जाए. इट्स बेटर टू बी राइट देन फर्स्ट. रेस्पेक्ट प्राइवेसी ऑफ विक्टिम्स एंड फैमिलीज. जो पीड़ित हैं, जो फैमिली हैं, जो परिवार है, उनकी प्राइवेसी की भी रेस्पेक्ट करनी होगी आपको अपने कलम और कैमरे में. Obtain informed consent before sharing personal stories, images or details. Protect identities, उनके आप नाम मत दीजिए. Where appropriate, and avoid intrusive reporting during moments of grief. Be culturally sensitive in global health crisis. Understand and respect local customs, beliefs, and practices, especially when reporting on disease in different culture context, as they can significantly impact public health responses and perceptions. Now we are going to discuss some case studies, as we also already talked about the COVID-19 global pandemic 2020 and 2022. And the context was the rapid worldwide spread of the SARS-CoV-2 virus led to an unprecedented global pandemic, overwhelming healthcare systems, triggering widespread lockdowns, and causing profound social and economic disruption. Broadcast example of COVID-19, a global pandemic, maximum new outlets were at the forefront of daily coverage. They extensively used maps, infographics, and expert interviews with epidemiologists, virologists, and public health officials to explain the virus spread, symptoms, and the efficacy of public health measures. So be sure, if you want to interview during COVID or a situation like pandemic or COVID, you have to be, interview a virologist, a public health official, epidemiologist, not other than that. Journalists had to demonstrate extreme adaptability with reporting evolving daily as new scientific information emerged. Trusted sources like the WHO and the Ministry of Health and Family Welfare became key for verifying information and providing context. The infodemic, a massive flood of both accurate and false information, as we shared earlier, was a major challenge. Journalists had to actively engage in fact checking and debunking myth while providing reliable updates. Now, case study 2 is Ebola outbreak in West Africa, 2014 to 16. This severe outbreak of Ebola virus disease caused over 11,000 deaths, primarily in Liberia, Syria, and Leone and Guinea, highlighting the challenges of containing highly infectious disease in resource-limited settings. Broadcast example, we can take news organizations like Reuters and BBC featured extensive on-the-ground storytelling, often from remote villages, showing the devastating impact on communities and the heroic efforts of health care workers. And what lessons we learned? The importance of cultural context became clear. Traditional burial rituals, for example, were identified as a significant factor in transmission, requiring journalists to explain these practices sensitively while highlighting the public health risk. Ethical dilemma. What was? Journalists faced the constant challenge of balancing personal risks to themselves and their crew members with the public needs to know about the severity and scope of the outbreak. You have to be careful when you are going to ground zero to cover the, any epidemic or pandemic. You have to be careful because you can be affected with the disease. Now, case study 3 is Zika virus in Brazil, 2015 to 16. The rapid spread of the Zika virus, particularly in Brazil, was strongly linked to microcephaly and other severe birth defects, sparking widespread fear, especially leading up to the Rio Olympics. CNN Health segment effectively used field visuals from affected areas and animation to explain the mosquito-borne transmission and linked to birth defects and prevention strategies. What lesson we learned from this Zika virus coverage? The case highlighted the importance of viruses and clear scientific translation. journalists had to simplify complex medical concepts like viral transmission cycles and neurological impacts into easily understandable terms for a broad audience. So, in last, we'll discuss about the reporting tips. Always double check numbers. Never report figure without verifying them from at least two officials or peer reviewed sources. Avoid alarmist language. Opt for precise measured language. Use words like increase, rise or spread instead of sensational terms like explosion or catastrophe, or which can include undue panic. Show empathy. Remember that behind every statistic is a human story. Focus on personal narrative of patients, healthcare workers, and effective communities, not just abstract numbers. So, this is all about the communication of epidemic and health crisis under the term of development communication. So, thank you for listening this, watching this. बहुत बहुत धन्यवाद. अगले एपिसोड में फिर मिलेंगे. नमस्कार.